Essential hypertension is the most common form of hypertension. The cause of essential hypertension is unknown. But there are risk factors. In primary, or also referred to as essential hypertension, the risk factors that are modifiable include obesity, sodium consumption, alcohol use, tobacco use, and sedentary lifestyle. Unmodifiable risk factors are things that cannot be changed. Ethnicity is an example. African Americans have a high rate of hypertension. Sex, males have a tendency to have hypertension more than females. And family history. Sometimes genetics plays a role in having hypertension. Age is another risk factor. Before the age of 55, hypertension develops more commonly in men. But after the age of 55, more women commonly get diagnosed with high blood pressure. Socioeconomic status is another risk factor related to hypertension, in the way that lower socioeconomic status may have less education, they may have financial limitations regarding access to health care or the ability to pay for medications. There's also something called secondary hypertension. So unlike primary essential hypertension, secondary hypertension has a specific cause for the elevated blood pressure. And these are some examples of what may cause secondary hypertension. Diabetes mellitus, kidney disease, pheochromocytoma, Cushing's disease, obstructive sleep apnea, pregnancy, vascular anomalies, neurologic disease, and some medications. Hypertension usually has no symptoms. It's usually detected on a routine visit to a medical clinic. So this is why it's so difficult to convince people to take their medication. If they're not having any symptoms, why should they take their medication for their hypertension? But hypertension can also cause many symptoms. Headache and visual changes, especially during stress, can be common early symptoms of hypertension. Long-term sustained hypertension damages blood vessels. Blood vessels that are exposed to high blood pressures become thickened, hardened, and making them less flexible. So here we see a normal blood vessel. But when blood vessels are exposed to high blood pressures, they become thickened and hardened. We refer to this as arteriosclerosis. So these blood vessels become less flexible. Fatty deposits can also form on the arteries. We call these plaques, which cause the artery to narrow and become blocked. This is atherosclerosis. So fatty deposits can form on the arteries, and we call these atherosclerosis. So know the difference between arteriosclerosis and atherosclerosis. Now we're going to talk about some complications of hypertension. Hypertension, sustained over a long period of time that's uncontrolled, can cause target organ damage. And so the organs involved can be the heart, the brain, the kidneys, the eyes, and the peripheral blood vessels. Infarction is when narrow arteries become blocked and blood supply to an organ is stopped. Organ damage results, and this damage is called infarction. Hypertension causes brain damage. Hypertension is a major cause of stroke. It's also referred to as brain attack or cerebrovascular accident. We could also call it cerebral infarction. Complications of hypertension, again, can cause brain damage. So in this picture, what we see is some plaque that has been formed in the internal carotid artery. And if a piece of this plaque can break free and travel into the brain, it can block vessels that supply blood to the brain. We call this infarction. So in this picture you can see the clogged artery, and then above that you can see the area where the infarction has occurred. Also, with high blood pressure, we have a weakening of the arterial wall, and the wall may actually balloon out. This is referred to as aneurysm, and this aneurysm can burst and cause hemorrhage, bleeding, and even death. So here we see hemorrhage in the brain as a result of aneurysm. So other complications of hypertension include kidneys. Hypertension is the leading cause of end-stage renal disease, and the damage results from the ischemia caused by narrow lumen of the intrarenal arteries. And these intrarenal arteries are responsible for supplying the kidneys with oxygen-rich blood. So here we kind of see a schematic version of the renal arteries. The nephrons are the individual functional unit of the kidney, and there are over 1 million. And so these are very, very tiny, and small vessel damage occurs inside the kidney at the level of these nephrons due to arteriosclerosis. The eyes are another organ that become damaged from long-term hypertension. Retinal damage occurs, blurred vision, retinal hemorrhages, and loss of vision. So here we can see some of the different disorders that can occur: flame hemorrhages and hard exudates, cotton wool spots, and they can all damage the eyes. So the peripheral blood vessels can result after many years of hypertension in a complication referred to as peripheral vascular disease. So hypertension leads to atherosclerosis of the peripheral blood vessels. So these are the arteries that supply blood to the extremities. Sometimes when patients have peripheral vascular disease, they have a symptom referred to as intermittent claudication. Intermittent claudication is when there is muscle pain in the lower extremity, and it results from a temporary inadequate supply of blood or oxygen to the extremity due to narrowing of the arteries. So this intermittent claudication causes actual pain that happens during exercise or walking. And it's more noticeable when the oxygen requirement of walking or exercising makes it more prominent.